Hello, I'm Dr. Sarah. Thank you for joining in to our PBS special on type 1 diabetes. Today we'll be teaching you about type 1 diabetes, and we will follow a case study of a current patient of ours, Robbie Jr., who has been diagnosed with type 1 diabetes. Let's take a look at Robbie Jr. and his mom Rachel 1 week ago.
Although the exact cause is unknown, environmental and/or genetic links have been found. Environmental links include possible exposure to certain drugs, foods, and viruses. Our interviewee, Tim, developed type 1 after getting pneumonia at age 13. Nobody else in his family has type 1 diabetes. A genetic link is also found on an allele that is also associated with other autoimmune disorders, such as celiac, Graves, Hashimoto, and Addison diseases.
Let's meet Robbie Jr. He is an 8-year-old boy, has no past medical history, and has felt rather healthy until recently.
Robbie, get up. We're gonna go outside. Robbie, did you hear me? We're gonna go outside.
I don't wanna, Mom.
Robbie Matthew, get up now. We're gonna go outside. It's a beautiful day out there.
No.
Robbie, let's go.
No.
Well, what's wrong? Why don't you want to go?
I'm just really tired, Mom.
Well, why are you so tired?
I don't know. I'm sleepy all the time.
Robbie, well, it's nice outside, so we're gonna go. Please, you gotta go tinkle before we go outside.
Can I nap outside?
No, we're gonna go play outside. It's nice outside.
You're so mean to me all the time.
Robbie, what is going on? Why are you going to the bathroom so much?
I don't know, I just had to go, Mom. It's private.
Okay, well, let's go. Come on.
Mom, I don't think this water is working.
Why? What's wrong?
I don't know, I drink it and I'm just still really thirsty. Watch. Still thirsty.
Still thirsty? That's not good.
Welcome back to Dr. Sarah's office. As you can see, Robbie Jr. exhibited signs of polyphagia, polyuria, and polydipsia, as well as lethargy and malaise when he was at the park last week. We found high amounts of glucose in his urine, and he's been diagnosed with type 1 diabetes, a very serious disease.
Type 1 diabetes is the most common pediatric chronic disease that affects kids in the United States. Age of onset is usually 11 to 13 years old. It is usually diagnosed as an emergency, or when hemoglobin A1C levels are greater than 6.5%, fasting plasma glucose is greater than 126, or 3 to 2 hour plasma glucose is greater than 200 during oral glucose tolerance test.
Let's talk with his mom and Rachel, see if they have any questions.
Hi, Dr. Sarah. I was just wondering, what is the patho behind type 1 diabetes?
I just don't get it.
Type 1 diabetes is a slowly progressive autoimmune disease that destroys the beta cells of the pancreas. The beta cells are the cells that secrete insulin, which helps with glucose metabolism. And since the pancreas will not be secreting insulin, hyperglycemia develops and subsequent starvation of the cells in the body occurs. Furthermore, glucagon, which is a regulatory hormone for hypoglycemia is also affected. Therefore, type 1 diabetics are at a severe risk of hypoglycemia as well. Lastly, for insulin synthesis to decline enough that hyperglycemia occurs, 80 to 90% of the insulin secreting beta cells must be destroyed. The pathophysiology behind type 1 diabetes is fairly simple. It's an autoimmune disorder where the body's own immune system attacks the pancreas. This results in a metabolism disorder of carbohydrates. So specifically, it's a T-cell mediated disease that destroys the beta cells of the pancreas. The destruction of the beta cells is related to both genetics and environmental factors. So the gene-environment relationship results in the body's immune system attacking the pancreas. Over time, insulin production declines and hyperglycemia develops. That's where you get the polyphagia, polyuria, and polydipsia.
Wait, Mom, what's the big deal? I feel fine. That's not me. My friends are normal too, and I'm normal.
Robbie, we have to find out why we need to treat this now because we have to make sure we can get it under control.
The reason you have to control your glucose is because of the long-term effects. Long-term effects include retinopathy, blindness, leg amputations, nerve damage, vascular disorders, including heart attack and stroke. That's why it's so serious.
Normally, our type 1 diabetics will take two different kinds of insulin, a long-acting taken once or twice a day, and rapid-acting bolus given throughout the day with meals and snacks. Today, Nurse Gabby is going to talk about the long-acting called Lantus. Welcome, Nurse Gabby.
Good morning, Rachel. Good morning, Robbie. I'm going to be talking to you about one of your medications. It's a long-acting insulin called Lantus. Basically, this controls blood glucose levels in diabetic patients, such as Robbie, without the appearance of hypoglycemic or hyperglycemic episodes. Let's talk about Lantus. It is an anti-diabetic medication which lowers blood glucose by stimulating glucose uptake in skeletal muscle and fat and inhibiting hepatic glucose production. It is considered a long-acting insulin as its onset is anywhere from 3 to 4 hours. It controls blood glucose levels in diabetic patients without the appearance of hypoglycemic or hyperglycemic episodes. Adverse effects of this medication include intense itching, erythema, and swelling. Significant interactions include hypoglycemia and anaphylaxis. Explain to the patient that this medication controls hyperglycemia but does not cure diabetes. Therapy is long-term. As nurses, we want to emphasize the importance of compliance with nutritional guidelines and regular exercise as directed by healthcare professionals. Instruct your patient on proper technique for administration, including types of insulin, equipment, cartridge pens, alcohol swabs. Remember, this is a long-acting insulin, and your patients will still need a short-acting bolus. Episodes of low blood sugar or hypoglycemia include sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, tingling hands and feet. Symptoms of high blood sugar include thirst, increased urination, confusion, drowsiness, flushing, rapid breathing, and fruity breath, also known as hyperglycemia. Once injected, site reactions may include pain, redness, irritation, or swelling of the area. If any of these effects persist or worsen, please tell your doctor or pharmacist promptly. So now I'm going to go ahead and show you how to administer this insulin shot into Robbie, and we're going to be doing this subcutaneously.
Okay. What does that mean?
It means that we're going to be injecting it into the first layer of your skin, and usually in your belly.
Okay. Mom, that sounds like it's going to hurt, though. Mom, are you sure? I think it's going to hurt a lot.
Robbie, would you rather lose a leg?
Maybe.
All right, so you're going to go ahead and take out your alcohol with that. Okay. And we're going to be cleaning around the skin.
Okay.
So go ahead.
That?
Mm-hmm. Okay. I'm going to have you draw up however many units of insulin his primary care provider has set up. And inject it. Like so.
Oh, okay. Do you have to pinch or anything?
Ditch the pinch.
Okay. Alright, so after inserting the insulin in the orange, I'm going to feed Robbie the orange, correct?
No. You're going to insert the insulin into Robbie, not the orange.
Okay, so we're just practicing on the orange.
Yes.
Okay, good to know.
So remember, kids, if you're feeling hot and dry, you're probably sugar high. But if you're feeling cold and clammy, eat some candy.
Some recommendations for people with diabetes is it is very important for people with type 1 diabetes to always get a routine flu vaccine because being sick can cause major complications such as diabetic ketoacidosis. It is also important that diabetics exercise. They should have a routine exercise regimen that they follow because the more that they exercise, the less insulin they will need.